Top 10 infectious diseases man has triumphed over. In the midst of a worldwide flare-up, it is not difficult to fail to remember that humankind has prevailed over numerous infections that used to destroy whole nations. Today, immunizations are assessed to save 3 million individuals from death consistently across the globe. A couple of illnesses have even been killed, gone everlastingly, with much more disposed of, gone from whole nations or locales. Despite the fact that we have far to go, it is consoling to think back on where we've been. Here are 10 of the best victories of present-day science over microscopic organisms, infections, and parasites. Number 10. Smallpox. Smallpox was an airborne infection that murdered about 33% of individuals who contracted it. There is no fix, so specialists basically held up around 14 days to check whether the patients passed on. On the off chance that they were adequately fortunate to endure, they were for all time scarred from the notorious red pustules that give the illness its name. In 1796, a British doctor named Edward Jenner saw that individuals who had cowpox when they were more youthful never appeared to get smallpox. To test this hypothesis, he infused the 80-year-old child of his landscaper with cowpox prior to presenting the child to the destructive smallpox infection. Shockingly, it worked. Jenner had coincidentally found the world's first immunization. His revelation essentially decreased the quantity of passings from the illness. When the World Health Organization, WHO, reported its arrangement to destroy smallpox in 1959, the infection was limited to South America, Africa, and Southeast Asia. WHO requested enormous measures of antibodies and taught nearby governments on the most proficient method to regulate them. In 1977, the last recorded instance of smallpox was found in Somalia. Accordingly, WHO formally reported in 1980 that smallpox was the primary sickness at any point to be annihilated by human mediation. Number 9. Rinderpest. Rinderpest, otherwise known as Stir's plague, didn't taint people, however was obliterating all the while obliterating. During the 1890s, an episode slaughtered 80 to 90% of all cows in sub-Saharan Africa. The individuals who relied upon these animals for meat, milk, and homestead work starved to death. The number of inhabitants in influenced territories was diminished by at any rate 33%. Any creature that endured the sickness could never get rinderpest again. Likewise, the high demise rate implied that wild creatures, like bison or giraffes, with rinderpest were cleared out before they could pass the infection to homegrown dairy cattle. During the 1960s, a British researcher named Walter Plowright built up an antibody, which the United Nations Food and Agriculture Organization began purchasing en masse during the 1990s. A large number of veterinarians across Europe, Asia, and Africa partook in immunizing cows, lastly prevailing with regards to clearing out rinderpest in 2011. It is the subsequent sickness to be destroyed. Number 8. Polio. Polio, short for poliomyelitis, is an infection that deadens its casualties. At times, the loss of motion is brief. Different occasions, it causes perpetual inability. Most dire outcome imaginable, it spreads to the lungs and the patient bites the dust. In 1953, Jonas Salk declared that he had built up an immunization for polio. He would not patent his disclosure to get it to whatever number of individuals as could reasonably be expected. Subsequently, he relinquished billions in the present US dollars. The March of Dimes supported a huge scope of immunization before it was mass-delivered for the US public. In 1979, just a short time after the inoculation was officially presented, the United States was proclaimed sans polio. To dispose of polio around the world, WHO made the Global Polio Eradication Initiative in 1988. Somewhere in the range of 1980 and 2016, there was a 99.99% decline in cases. At present, polio is just found in Afghanistan, Pakistan, and Nigeria. Number 7. Guinea worm. When an individual drinks stale water debased with guinea worm hatchlings, the worms go down to the digestive organs to mate. Following 10 to 14 months, the female worm moves similar to the human foot. There, She makes an excruciating skin sore that drives the host to absorb his foot in a lake or stream, which delivers the hatchlings into the water. From that point, the cycle rehashes. In spite of the excruciating sores and the potential for bacterial contamination, guinea worm is seldom lethal. Be that as it may, when in doubt, individuals don't really want to have worms recreating in their digestive organs. The Carter Center is driving the charge to utilize water decontamination to forestall the spread of guinea worm. Up until this point, it's been unfathomably effective. McGill University gauges that there were 3.5 million cases in 1986 all through South Asia, Yemen, and Sub-Saharan Africa. In 2018, there were 28 revealed cases around the world. Number 6. Yaws. Yaws, also known as Frambesia, is brought about by skin-to-skin contact with the bacterium Treponema pallidum per behavior. Inside a quarter of a year of being tainted, the patient will create raspberry-like sores on his skin, particularly his face. These disappear inside a half year, just to emit again later and leave scarring. People being people, these scars can prompt harassing and separation. During the 1950s, yaws was endemic in more than 70 nations. Since it is handily restored with a solitary portion of the antimicrobial azithromycin, it was one of the primary infections focused by WHO for annihilation. Yaws was nearly cleared out during the 1960s, however smallpox got more consideration and interest fell in yaws. In 2019, yaws was as yet present in 15 nations. Number 5. Hookworm. Hookworms, which live in sewage-defiled soil and enter through the patient's feet, venture out up to the small digestive system where they drink their casualties' blood. From that point, they cause dormancy, sickliness, bulging, and hindered development. As they live in zones with helpless sewage treatment, the patient frequently craps them out and the hookworms end up in the ground once more. From that point, they discover new feed to attack. In 1910, John D. Rockefeller Sr. gave $1 million to kill hookworms in the American South. Following a 5-year crusade, contamination rates were altogether diminished. Far and away superior, more children were appearing at school and really focusing since they didn't have worms sapping their energy. Notwithstanding the close to disposal of hookworms, there is a high pace of reinfection and the worms can return. To overcome hookworms unequivocally, the Human Hookworm Vaccine Initiative is making a medication that interferes with the worm's capacity to eat. Before long, they may be away for acceptable. Number 4. Measles. Yes, this one has made somewhat of a rebound lately in light of the fact that individuals haven't kept on inoculating against it. In any case, around the world, measles cases have been radically diminished in the previous 50 years. Before 1963, pretty much every youngster in the United States got measles before age 15. Significant pestilences happened each 2 to 3 years, with a normal of 2.6 million passings consistently because of the illness. It has gone through hacking and sniffling. In 1954, Dr. Thomas C. Peebles of Harvard University wiped out 11-year-old David Edmonston in the event that he needed to be of administration to humanity. David let the specialist swab his measles-tainted throat. Dr. John F. Enders had the option to segregate the infection from his example and made the Edmonston-Enders antibody that is as yet utilized today. Somewhere in the range of 2000 and 2018, measles passings dropped 73% because of mass inoculation, saving an expected 23.2 million individuals. Indeed, even in the United States, where measles was disposed of in 2000, just 1,282 cases showed up in 2019. Number 3. Tetanus. Tetanus is brought about by the bacterium Clostridium tetani, which lives in soils everywhere in the world. The microorganisms enter the body through an open injury, where they discharge a poisonous compound that causes loss of motion and difficult muscle compressions. As C. tetani is impervious to synthetic substances and warmth, lockjaw is probably not going to be annihilated. Be that as it may, it tends to be wiped out, no new cases, through mass immunization. Up until this point, endeavors have been staggeringly effective. In 1990, 314,000 individuals passed on lockjaw around the world. In 2017, there were just 38,000 passings. That is a 88% decline. The most elevated quantities of cases are in South Sudan and Somalia. Number 2. Elephantiasis. Elephantiasis is brought about by 3 types of thread-like worms that stop in their casualties' lymphatic framework. This disturbs the body's capacity to control fluids, which can make the tainted appendages or private parts swell to elephant-like extents. While the worms are in the lymph hubs, they discharge hatchlings into the circulation system. Along these lines, if a mosquito nibbles somebody with elephantiasis, it passes the infection to the others it jumps. Certain drugs can be utilized to treat the ailment. Joined with safeguards against mosquitoes, this can stop the spread of the illness. Since 2000, in any event 7.7 billion medicines have been conveyed to in excess of 910 million individuals. 16 nations have killed elephantiasis, and 7 more are under reconnaissance to check whether they can make the run down. Number 1. Malaria. Malaria is brought about by a little parasite in the blood that is spread by mosquitoes. Side effects incorporate fever, chills, migraine, queasiness, and body hurts. Albeit the sickness keeps on contaminating individuals across the world, humankind has taken gigantic jumps in fighting it. Jungle fever has been endemic in Europe, Africa, and Asia since days of yore. At the point when Europeans colonized North and South America, the infection hitched a ride. Students of history gauge that, at the height of the infection, occupants across 53% of the world's landmass confronted the danger of contracting jungle fever. In the United States and Europe, the 1900s brought new agreement with respect to how intestinal sickness spread. Wetlands, where mosquitoes reared, were depleted or filled in. Insect sprays were mass splashed. One association, the Office of Malaria Control in War Areas, later turned into the Centers for Disease Control. The 21st century has been extraordinarily beneficial in the battle against jungle fever. Somewhere in the range of 2000 and 2015, the quantity of intestinal sickness passings dropped from 840,000 per year to 440,000. The greater part of the individuals who kicked the bucket were youngsters in Africa,